Good morning, everyone, and welcome today to Davies' webinar on sustainability tips for the vet practice with Ellie West. For those of you who haven't used Teams before, Ellie is more than happy to take a Q&A. There are points throughout her talk where she can answer those, or at the end of the talk. So any point you have a question, please do feel free to pop that in. And if you look to the top right of your screen, there is a speech box with a question mark. If you just click in there and you can write your question, and you can send that anonymously if you would prefer. And as I say, there is a little bit of a time delay, so if you do have a question at any point, please feel free to put that in. It won't disturb us, and we can actually answer those at some points through the talk as well. Without further ado, I will hand over to Ellie for you. Thank you, Ellie.
You're very welcome, Becky. Nice to be talking to everybody this morning, and on of course on a topic that I'm very passionate about. So the way that we're going to run today is I want to give you a bit of background. I told Becky that this was going to be relatively short. As it happened, as I started writing it, I thought, well, maybe it's useful to have some of this information in. There's quite a lot of words on some of the slides, but I've tried to put the resources in there so that you can follow up on this later, or you can watch it back slowly. I'll try to give you 5 top tips to where to start with your sustainability journey in your practice. But really the point of today is question and answer, because everybody is working in a different setting and has different questions. So we will open up to Q&A at the end, but as Becky said, when we're past each of the 5 top tips, Becky, remind me to stop, and we'll answer any questions that have come in on those topics. And if I can't answer them, what we're doing after each of our webinars is producing a written FAQ document, and we'll go through the answers and put any further resources in there as time goes on, and those are all posted on the Davies website. So I just wanted to touch on why we started this journey. One of our anaesthetists went to a talk by Hugh Montgomery, and if you Google Royal College of Anaesthetists Aries talk on climate change, then you can find the same talk. It's 20 minutes. He's a medical professor of anaesthesia, and he gave this kind of apocalyptic view of how climate change is going to impact on people. So one of our anaesthetists went to that talk live and came back and said, we've got to start a green group. And our director said, yeah, go for it, let's start a green group. And so we joined Investors in the Environment, and we started our green group. We run events, we put our audit pack in, we got accreditation, so we're now at green level accreditation with IE, and we were shortlisted for the best team award in the Institute of Environmental Management and Assessment last year. So we've kind of been on this big journey, and I'm very pleased to say now I've handed over green group management at Davies to Rachel Evans, and she is now managing the Davies stuff day to day, and I'm moving on to helping with Linnaeus. The SPIVS BMG podcast, we did at the conference Sustainability Day in January, and so there's a lot of information there. We've got NHS speakers, IE speakers, waste management expert. So those podcasts are all available on the SPIVS website, and that gives you a bit more detail of our particular journey, if you're interested. So it's important to understand why we should engage in sustainability. I think we have an individual duty, that's very clear to me. We know that we produce around about 10 tonnes of CO2 per year, depending on how you count it. But it's around about that sort of level. And we have individual choices to make, but we also have a social duty to our communities, and that includes people in our local communities, but also people in our global community. So sustainability is often framed as a people versus planet argument. You know, if you do this, you will impact on the environment, you'll impact on ecosystems. But actually those ecosystems have people dependent on them. So actually some people will frame it as a people versus people debate. We need to be looking after the other people in our global community, and the choices that we make in terms of sustainability will impact people both locally but also around the world. We have legal duties, so there is new environmental legislation coming in with the environmental bills post-Brexit, and the UK government has committed to net zero targets by 2050. Apologies if you can hear the rubbish ban in the background. He's going back down the other end of the street now. But ecosystems also will have an impact on us and our industry, and I've got a slide on that later on. Just to recap what I'm classing as sustainability, there was a definition of sustainable development in 1987, which encompasses major points. And it's really saying not about just us now, but about future, and saying that whatever we are doing, we need to be living off the capital, off the dividends, rather than eating the capital of what the planet can provide for us. The Brundtland definition is often broken down into people, planet, profit. And it's obviously a handy thing to remember. I see the profit part as more a financial resilience. You know, you do need a certain amount of economy and money to provide for the people and the planet, but it's not necessarily just about economic growth and making profit. But there's another definition from the University of Newcastle, which is enough for all forever, and I really like that, and just sort of saying we need to change the consumerist patterns that we're living in to make sure that we are sustainable. So what are the challenges? I see these three crises. We have global heating, we have biodiversity loss, and we have resource scarcity. In terms of resource scarcity, I've put water there, but in terms of rare metals, in terms of soil fertility, in terms of energy, those are all resources that we are going to be struggling for. And there are likely to be increasing global inequalities and health threats, limits for the waste that we can dispose of, weather events, sea level rises, mass extinctions. And these pressures are likely to result in increasing conflict in our society. So we need to look forward to how we're going to deal with these and how we can plan for these within our business activities. When we started at Davies, we probably had a list of 4 things that we figured as our environmental impacts. And as every year goes on, my list for our environmental impact grows, but also our awareness of how we can manage those impact grows. So I don't see this list as a bad thing. Actually, I see this list as an opportunity for where we can do things better. Indeed, where we can do things well and actually have a positive impact. I said I'd talk a little bit about how I think this is going to impact on vets. I think there are a lot of unknowns in this, but I've tried to put the known parts here. We don't know exactly how spending patterns will change, particularly post-COVID, but we do know that there is a big public interest in driving a green way forward. We know that some resources will become reduced or indeed more expensive to provide, and so the better we can manage our resources, the more available those will be to us, therefore the better quality that we can maintain in our care for our patients. We know that disease patterns are changing. I don't need to mention the C word, but you can talk about Lyme's disease, you can talk about some of the infectious diseases that spread through Southern Europe and northward that we're likely to see impacting in the UK. There are more legal controls, but perhaps the biggest drive is going to be the socially acceptable norms. What pet owners, what society demands of agriculture, how our diets are going to change, how we expect our land use to change, and all of those things will affect how we practice and how we can practice. So I think we need to be asking ourselves, are we ready for this? Are we preparing for this? So I want to move on to our top tips. And my first top tip is become carbon literate. So there's a number of levels that you need to become carbon literate on. Firstly is to have an idea of your own personal carbon footprint. Now, I've seen one source that says in order to meet our 2050 targets for net zero carbon emissions, we need to each be heading towards a carbon budget of around about 1 tonne of CO2 equivalents per year. And I said roughly the UK average is somewhere between 7 and 10 or so at the moment. So if you go onto the website for the WWF there's a little, I think it's about 7 questions to calculate your own carbon footprint. And while I know everybody's listening avidly, please feel free to do that questionnaire while we're talking today, and you know, indeed post it into the chat forum. You can put it anonymously if you like, and we can sort of get an idea of where people's personal carbon footprint is. But I think it's important to accept that the kind of transformative change that we need will not come through just individuals. It might come through mass individuals adding pressure to societies and governments, but that needs to happen as well. So we need societal change, we need sector change. So the next thing that I would recommend is doing a practice carbon footprint. Because if we know what our carbon footprint is in our practice, it gives us a real sense of our biggest impacts and gives us quantitative data to provide feedback and encouragement. From a practice point of view, you're also then monitoring the resources which are most costly and therefore those which you can make the easiest wins in terms of financial savings. So from my experience in looking at data for our practice for across Linnaeus and across the NHS, The ones that I would bother to start putting into your carbon footprint are the ones that I've listed there. If you want conversion factors for electricity, gas and oil and diesel, petrol, then they're in the government website at the bottom. And what you want to do is put everything into CO2 equivalents in terms of kilograms or tons of CO2 equivalents. The value conversion factors change every year, so that government document is updated every year, and it will depend. So for instance, whether you're using diesel or petrol for a car, whether you're using propane or butane gas canisters, there are different conversion factors. So I can't give you one for everything, but the UK mains grid electricity, for instance, has one conversion factor. So it's worth putting that into a pie chart and just getting a sense of, okay, you know what, let's target the biggest part of the pie chart. To give you an idea of what the NHS does in terms of its carbon footprint, this is data from 2018, and they included some things which I didn't put on the previous slide, which were procurement and travel. When you talk to sustainability professionals, they like to split emissions, your carbon emissions, into 3 categories. Your scope 1 and 2 would more or less be covering all of your energy. So what the fuels that you're directly burning on site. So things like your electricity usage is scope 2, or your gas usage is scope 1. So your scope 1 and 2 emissions. But these emissions here, the procurement emissions and the travel emissions, those would be pushing into scope 3 emissions. So they don't classically get included, but the NHS has done a really good job of adding those in. And from that, you can see that whilst building energy use is a fair old chunk there, actually procurement of pharmaceuticals and procurement of medical equipment and travel add up to a really substantial part of the carbon footprint. So we have to accept that healthcare does have a carbon footprint. The NHS knows that it contributes around about 5% of all UK emissions. And just to give you some context, agriculture is about 10%, transport nationally is about 27%, energy nationally is about 25%, and waste management is about 4%. So the NHS does have a significant footprint, and we, by extrapolation, can assume that probably vet practices do too. Just to give you an idea of what a vet practice carbon footprint looks like, I've put these emissions up, which are our 2019 data. Bearing in mind, we don't include our scope 3 travel and procurement into these, other than the diesel for our fleet vans, which we know are big hitters, so we're dealing with those as part of our footprint elsewhere. But what you can see for us is that we've got a huge energy burden, particularly our gas burden, which we need to work on. But also there's an 11% chunk which is coming from anaesthetic gases. So we know that for us, obviously tackling energy efficiency and anaesthetic gas usage are the big hitters for us, and that breakdown will change for each practice. So if you do that breakdown, then you can get a good idea of where you can make big changes. If you are only on electricity, a biggest change will come from switching to a renewable electricity provider, for instance. The other thing that you can look at is if you for instance, electricity is a big hitter, you can look at where your high energy users are in the practice, and I've put these devices here. We've got a forced air warming unit at the top, the blue thingy. The top right is an air conditioning unit. Bottom right is a active scavenging unit. Those often have a 3-phase main supply, so they're pretty heavy users. And on the left is at the bottom is an oxygen concentrator, and again they're fairly heavy users. Now I haven't seen a carbon footprint for oxygen concentrators versus transporting oxygen cylinders. So when I get that data available, that'll be interesting to see which is better. I suspect if you can run an oxygen concentrator off renewable energy sources, renewable electricity, that will be the greener option, but I don't know that yet. So I think I'm on top tip 2 next, Becky. Have we had any questions so far?
Not so far. So just a reminder, we had some late joiners. So if you do have any questions, top right hand corner speech box with question mark, please feel free to pop your questions in there and I can field those to Ellie.
Super duper. Right, if any come in, Becky, feel free to interrupt and we can add them in.
Will do, thank you.
Cool. Top tip 2. My presentation will move on. There we go. Lower carbon anaesthesia. So I said for us at Davies, anaesthetic gases are a big hitter, and I think that they probably are in most practices as well, just because the volatile agents have such a greenhouse gas effect, essentially. And this is because as you release them as a vapor, so even if you use a scavenging type of system, so if you're not just releasing the waste anaesthetic gases into your operating room, whatever system you're using other than the charcoal absorbers is probably releasing these anaesthetic gases straight into the atmosphere. So active scavenging units will certainly do that. Sticking your hose out the window will obviously do that. If you use a charcoal canister, it will absorb the unit, and then it depends on how you dispose of that unit. If you're burning it as pharmaceutical waste, then you won't be releasing it as a greenhouse gas, but you might get other impacts, so which aren't totally defined, which is why I'm being a bit vague about them. So we don't know entirely whether that system is going to be better. I suspect not, because you've got to transport the canisters. Anywho, lower carbon anaesthesia. So you can look and compare the anaesthetic agents, but it's the global warming potential, GWP, over 100 years that we usually use to compare them. So CO2 would have a GWP of 1, and you can see then sevoflurane is 130, ISO 510. Nitrous oxide has a very big impact despite a smaller global warming potential, because it's not very potent, so you've got to use a lot more of it. So I'll give you some comparative indications of how much it costs to use nitrous, but you can see that nitrous and desflurane are going to be the biggest and easiest wins in terms of not using those agents and reducing your carbon footprint. So I've put 2 resources down there. The environmental sustainability article that table comes from is available free access, I think, for another 9 months or so. That VAA have done that, and there's a podcast to go with that explores some of the themes more. If you look in the NHS, the anaesthetic gases contribute about 5% of the total carbon emissions, and if you're looking particularly within the surgical process, that somebody did a life cycle analysis of medical hysterectomies, and the anaesthetic gases account for 70% of the total surgical and anaesthetic carbon footprint. So you can see that in terms of the acute care that we provide, reducing this anaesthetic gas usage is a way to tackle our carbon emissions. Now you might say, well, it's only 5% of the total carbon emissions in the NHS. That's not really a big deal, and it is a relatively low contribution in terms of percentage to global carbon emissions as well. But they're disproportionately effective as greenhouse gases because they absorb infrared radiation within a window, a natural window where other greenhouse gases, other naturally occurring greenhouse gases like CO2, like water vapour, don't have a great absorption spectra. So there's this natural window by which the Earth cools itself, and unfortunately the anaesthetic gases absorb radiation in that frequency. So they are disproportionately effective as greenhouse gases, so there is an imperative on us to control them. Now, the rather cool Dr. Tom Pearce of Southampton, and he's the environment advisor to the Royal College of Anaesthetists, very kindly created a veterinary carbon calculator, which we're talking about trying to put into a package to release free of charge. But the carbon calculator allows you to basically plug in the fresh gas flows that you're using, the dose of drug that you're using for those drugs that we've got data on, and actually work out what the impact in terms of carbon CO2 kilograms equivalent are for a certain procedure. So we did this for an assumption of a 30 kilo dog having a cruciate surgery with some sort of, normal sorts of doses. So if you're using an isoflurane and nitrous oxide base for your anaesthetic, and I think in this protocol I assumed that you were using an alpha-2, an opioid, a regional anaesthesia, and oxygen, as you would normally do for a cruciate surgery, that if you're using ISO and nitrous, you can see the total carbon footprint is around about 68 kilos of CO2 equivalent. The bulk of the carbon footprints are coming from nitrous oxides. Here we go, nitrous oxide here. Vast majority of the rest of them are coming from isoflurane, and the rest is mostly the energy required to heat the operating theatre, provide the air conditioning units for the facility, what else? Run the syringe drivers, run the anaesthetic machines, run the bear hugger, forced warm air units, and that sort of thing. If you do a TIVA protocol, so you're basically using propofol and fentanyl for doses that are compatible with anaesthesia in dogs, you take it down by more than a factor of 10. And you can see that the big part of the footprint now comes from commuting and energy. The propofol percentage on this was 0.0013 3. So I didn't put the number in there, and I didn't put a colour for it because you just can't see the colour. So you can see that the propofol footprint and the drug footprint is pretty low, and it's mostly coming from energy and commuting, actually, of getting your staff to site. However, so this might give you the impression that propofol Tiva is very much the way to go in terms of reducing your carbon impact. And if you are literally looking at carbon figures, you can see that there's a clear win there. However, Tiva is not without impact. You still need resources to make these drugs. And we know that up to 100 kilos of waste per kilo of pharmaceutical can be generated. And that we know that there is a potential toxicity in terms of biodiversity. I think I'm going to talk about that potentially later, but we don't fully understand what happens to the propofol metabolites when they go into the environment. So if everybody in the world switched to propofol and then we all start weeing out propofol metabolites, there could be biodiversity consequences which we don't fully understand. Just to give you an idea, if you do life cycle analysis of a drug like morphine for intravenous use, over 90% of the footprint comes from the final stages of preparation, which are more or less the packaging and the sterilisation. So there are still big wins that we can potentially have in terms of our drug usage to get those numbers down further. Obviously, if you're giving it IV or parenterally, you need to sterilise the drug. But if you're giving it enterally, you don't necessarily. And we can find lower carbon ways of packaging. So how can we, what can I say in terms of big hitters for lower carbon anaesthesia? I think not using nitrous oxide. I'm presuming that nobody's using DES. Checking your machines and breathing systems regularly for leaks. This obviously has health and safety implications, but you're also taking down the risk of leakage and therefore the loss of these agents. Use circle breathing systems. Use your capnograph well to prevent rebreathing. So you're only using fresh gas flow just to prevent rebreathing. I'll give you some more resources on that. Use volatile agent sparing drugs. So you're using PIVAs, or you're using CRIs, you're using regional anaesthesia, you're using systemic analgesia. Avoid drug wastage. So we know about 50% of medical propofol is binned because you draw up more than you need for the patient and then you bin it. So there are management systems that you can put in place to reduce that wastage. You can train and support your staff. And you can audit the usage of these drugs, and that provides a real incentive for feedback for your staff. And you can look at enteral medication where it's appropriate. So I mentioned that we had some lower carbon resources. These are mostly on our Davies website, no, all on our Davies website. I'll give you the web links there as well. But if you go to vetspecialists.co.uk, we've got these resources to support not only environmentally friendly anaesthesia, but how to use less oxygen. And if you're using less oxygen, you're going to use less isoflurane. So we produced these in the early stages of the COVID outbreak when there was a concern about obtaining medical oxygen. So those resources are available now, and there's podcasts, webinars, cheat sheets, all available with each of those. We're on to 3, Becky. Any questions so far?
No, they're just all engaged and listening. Please carry on, and reminder again, top right hand corner if you do have any questions. Ellie loves a question, so please do feel free to pop those on there.
Yeah, do ask questions, otherwise I'll feel like I've pitched it entirely wrong and everybody's asleep. And anyway, we need to go back to the plan B, Becky. Okay, right. So you're saying that never happens? People never fall asleep during webinars?
Certainly not of yours, Ellie.
Oh, thank you. You're so kind. We'll never know. Right, top tip 3, tackle your waste. This is probably the biggest section because it's the section I get asked about the most. So I hope that I can give you some clarity and point you in some directions for how you can go with waste. It's a very hot topic, and it's particularly relevant given the difficulties in recycling waste and the issues around plastics pollution that were highlighted by the Blue Planet series, but also the increasing controls which are going to be introduced on hazardous waste in this country. We know, I've already said, the carbon footprint of procurement of medical equipment and pharmaceuticals is pretty high in the NHS, and we can assume it is so in the vet sector as well. But you can tackle a large part of your carbon footprint for waste by looking at this waste hierarchy and preventing the waste in the first place. Now, if you look at the bottom of the waste hierarchy, and you see that only around about, so disposal is the last option for dealing with waste. It only accounts for about 1% of the carbon footprint 0.1% of the carbon footprint of a practice and of the NHS. So the waste disposal sector is reasonably carbon efficient, but waste is expensive to dispose of and to buy. So from a practice point of view, the more you can engage in actually moving your waste up this waste hierarchy, the more environmentally friendly it will be, the more money you'll save. And we know that the majority of the waste that you produce in a healthcare setting is similar to domestic or black bag waste. And audits from medical waste from anaesthetic rooms suggest that 50% of waste can be recycled. So my daughter's just come in dressed in a troll's outfit. Lovely. So this waste hierarchy that I presented here, sorry, the links got lost on the bottom there. It's a statutory tool within the 2012 waste regulations, and these regulations are a legal document which oblige every individual, not just in the healthcare setting, but in your domestic setting as well, to correctly segregate and dispose of waste. And if you do that, and if you follow these waste guidelines and you follow the waste hierarchy, it automatically moves things into the least environmentally harmful option. Let's move on. I put this article here just to highlight, so part of the reason the waste sector is going to be needing us to help them out is they're still dealing with 1,000 tonnes which were dumped. When was this article? 2018 or so, by a waste company that went out of business. There are 7 sites around England and Scotland with these. They open, inspectors went out to these sites, opened the warehouse doors, and then oh my goodness, and shut them very quickly because there's waste spilling out of all kind of hazardous waste. So the waste sector is trying to deal with that hazardous waste, and there will be an increasing issue on how you can deal with that, but also the controls for how you deal with hazardous waste. So it's worth getting on top of this. The most important thing is how you segregate the waste, and that will again automatically move you into the right category in terms of environmental management. There is this document, HTM 0701. It's undergoing update at the moment, but it more or less splits waste into these EWC, European Waste Code categories. So whether you know it or not, when you put a waste into a bag, you are choosing an EWC code for that waste, and then the waste contractor that picks up from you has to sign documents saying, I'm picking up this EWC code. You promise me that you're giving me the right stuff, and I promise you I'll deal with it in the right way. And that's the contract between you as a waste producer and your waste contractor as the waste broker or waste disposal agent. To help you with this, we've produced these waste posters, which we produced as part of our process at Davies of trying to work out where waste went. And you can download those from our website. But there's also an article coming out in June's in practice on waste management, which we wrote with Anne Woolridge, who's a medical waste expert, and she's now leading on medical waste for COVID nationally. So she's a busy lady, but it helps you to get a sense of putting things in the right bin. And actually it's a legal responsibility to put the right thing in the right bin, and your waste disposal contractor is within their rights to refuse to take waste from your practice if you are not segregating it correctly. So there's a real legal imperative to do that, as well as a financial one. So I just want to go through the waste hierarchy from top to bottom. So how can we prevent and reduce waste in the first place, going down to how we can make disposal more environmentally friendly. So there's a few things on this slide that more or less the things that I've put on the left hand side of the slides are the things that you can reduce or choose better options for, and the things on the right hand side are ways to choose the more environmentally friendly option if you've got to do it, let's say. So on the left hand side at the top, we've got our air source heat pump, and we've got 3 air source heat pumps across the practice at the moment, and those are direct replacement for gas or oil boilers. They provide air conditioning and air heating, and those will reduce your energy costs as well as your electricity consumption. They're just more energy efficient. IMS have produced a green range if you go onto their website, so they are now producing these plant-based rectal gloves, and I believe that they're getting plant-based aprons and something else plant-based coming out very soon, as well as the EnviroPouch re-sterilising pouches, which are like where you can reuse them for sterilising surgical equipment. At the bottom, we've got biogas. So if you can get your food waste into a anaerobic digester facility rather than putting it into landfill, you vastly reduce the carbon emissions. So you can get something like, for every kilo of food waste, about 4 kilos of carbon emissions if you just put it into landfill, versus if you put it into an anaerobic digestion facility, it reduces the carbon footprint and it produces a biogas, which then goes into the mains grid for gas. You can use something like sterilium, so that's an alcohol-based gel instead of Hibiscrub. It's less allergenic, and it reduces the water consumption and the chemical needed to get your hands clean for surgery. You can do something as simple as putting turn-off stickers around your practice, and these are Carbon Trust ones, which are available on download from their website. And you just stick them by your light switches and just persuade people to turn things off or your air conditioning units. At the bottom here, I put these bio bins, so you can use cardboard bins instead of hard plastic bins to deal with your pharmaceutical waste. So that's a really easy win, and it saves you a fair bit of money as well. But also, if you look at cytotoxic waste, not all cytotoxic waste needs to go into a hard plastic bin with a purple top. Soft cytotoxic waste can go into a pharmaceutical bag that's of a suitable grade. Now, these bags should be UN graded, UN approved, so they are more expensive than your regular bags, but that is the legal container for soft cytotoxic waste. But again, that'll be less plastic. You've got to put it into a legally compatible container, but it's less plastic than a hard plastic bin. I put these BD Emerald syringes here. They're made with 30% less plastic than standard syringes. They went through a remoulding process. You can choose things with a grading system. So FSC, PFC is for paper. They're from Sustainable Forests, and phthalate free doesn't have PVC in. If you have PVC and you burn it, as a lot of medical waste needs to be burnt, then you released respiratory dioxins, which are more or less respiratory pollutants and can contribute to respiratory disease in people. But you can choose things with product declarations, or you can choose things that are just a better way of doing the thing that you have to do. So that there's lots of options available. Those are the ones that we've sort of come across at Davies. You can look for reuse options, and this covers domestic and medical. So I think the thing to do is look in your practice and think, what are we using a lot of? What are we chucking a lot away of? And is there an alternative for reuse? Now, with any reuse option, you've got to consider infection control and backhaul costs. So by which I mean, so if you're using bank pens, you've got to make sure that those pens are cleaned. But it might be an easier thing to control infections to clean bank pens regularly, rather than everybody have their own pen that they maybe leave about and then that isn't necessarily cleaned on a regular basis. So you've got to consider it. The bottom left here, we've got these Sharp Smart bins. These are reusable Sharps bins. So rather than buying and burning a plastic bin, those bins are taken away by your Sharps company, emptied, cleaned, and then sent back to us. So you're only paying for the waste that you're actually generating to dispose of. But again, you've got to consider the transport of those bins back and forward, and that transport has a carbon cost as well. We've been using these sterilisable surgical tins at Davies for 20 years or so, and these bins are expensive, but they last for that length of time. And so there's less time taken by the surgeon to have to unwrap everything, because you put the tin on the top for the surgeon, you take the lid off, they lift the tray out, put that onto their drape, and then you take the tin away. So there's no drapes and there's less time taken. So there's lots of options for trying to look for reuse within the medical healthcare setting, and there's more coming online. In terms of recycling, the thing to just bear in mind is you can look for products which have recycled content, and you can look for products which are recyclable. You just have to be aware of the waste legislation in terms of what is allowed to be recycled. And I think I touch on that when we get to the next slide. But there's a few websites there of agencies that can help you with recycling options. So in terms of disposal, we have to obey the law in terms of how you're allowed to dispose of things. And this is a table taken from the In Practice article. But you need to look at what are the options and move up the waste hierarchy where it is possible. So for instance, the pill bottles on this that I've put on the slide are labelled as recyclable. But if they have contained a pharmaceutical preparation, then they have to be incinerated. So you have to just be a little bit careful about what you say you are recycling, because actually you need to be dealing with things in a legally compatible way as well. But where you can, there is a lot of offensive waste, for instance, that could potentially be recycled. We need to set up the appropriate contracts with your waste disposer to do that. Okay, that was top tip 3. Anything on that, Becky, so far?
So it's not necessarily on that, but just overall, we have had someone. So good morning, thank you for the webinar. I'm the surgical intern at London Vet Specialists and currently helping to get our sustainability journey started. So welcome, and certainly
congratulations.
Yeah. I was wondering, with all the coronavirus situation and the use of fabric masks increasing, is there any evidence of the benefit of using disposable masks instead of fabric ones in theatre? Also, can disposable masks be reused, let's say during the same day? Thank you very much.
So I think this is a question for the surgeons, but we have had discussions with our surgeons about this, and certainly with surgical grade masks. I'm not talking about COVID protective mask, but I'm just talking about the regular masks that we would wear that have gaps around the sides. About the efficacy of them after a certain duration. Most of what people are needing to wear for COVID is more or less to stop large droplets, and over the long scale, what those masks are doing is preventing a sneeze and big droplets from a sneeze from landing in the surgical wound or indeed infecting somebody else with COVID. So that's why we're wearing them at the moment, in which case it is highly likely that reusable fabric masks will be as compatible, but the evidence is still coming out on that. In terms of what you need to wear in surgery, it is very difficult to document a change in infection rates because the infection rates tend to be so slow, and there are so many factors which lead into why a particular patient becomes infected. Their original disease process, the surgery that you're having to do, the degree of surgical contamination, the length of surgery, the temperature that the patient gets to, these can all contribute to a risk in surgical infections. So if you're trying to, if you're wanting to find a study that says reusable masks reduce the infection rate compared with disposable, I don't think that we have that study available. There was a RCVS knowledge review that looked at reusable textiles for drapes, I think, and didn't find from the current evidence base a difference between disposable and reusable. But we have to remember that with reusable fabrics, you will get strike through at some point after so many washes, and we don't exactly know when that will be. Plus, there is a cost in terms of time of folding that stuff. In terms of carbon footprint, we've got evidence to say no, there is a reduced carbon footprint with a reusable item, even if you factor in the cleaning of that product. So I think the issue is more the time it takes to fold that stuff and get it back into the autoclave, plus the space it takes up in the autoclave, plus the strike through risk. So I think that we will be using reusable masks to stop COVID spread in our practices. There is some evidence to say that disposable hats, particularly the kind of really fabricy Norabati style, I absolutely hate them, that kind of really give you a elastic rash across the top of your head. So those kind of cheaper ones can shed a lot of microfiber. So we know that those shed more microfiber than a reusable hat. So it's possible that we will get similar data out for reusable masks in the long term, but I don't know that study being there. So I think the answer is the surgeons need to have a chat about, do we really need to wear surgical masks? When do we really need to wear surgical masks? Who needs to be wearing them? And how long you can use the same bit of mask for. In our practice, like I say, it's going to be very difficult to document infection rates, and I think that pragmatically we are reusing our surgical masks at Davies through the course of a day, if not longer, because of the availability of PPE. And you've got to question whether we should be taking PPE into vet practices that needs to go into the NHS at the moment. So yeah, difficult one, but get your surgeons onto it. We need them. We're certainly getting our surgical colleagues involved, and they're doing a lot at Davies at the moment.
Thanks, Ellie. We've had another one come through. So we've discussed offering some sort of system whereby clients bring pill pots back in for repeat meds. They could then receive some sort of discount as an incentive, and it means we give out fewer pill pots, which are then thrown in the bin. My clinical director was concerned about the legalities of this if meds have already been in that container with broach dates, etc. I'm thinking tablets more than liquids or suspensions. Hope that makes sense, and thank you for hosting this CPD.
Yeah, I would need to check with our medical waste expert, because it's getting into confusing territory. Again, in terms of the number of pill pots that we produce and use, and the number that we would actually get back, the client having to drive back, because this would only be for repeat prescribers, my sense is that it's probably not the biggest impact or the biggest thing to tackle. In terms of whether you can do it or not, if you're putting the same medication in, you could argue perhaps, but like you say, there will be residue from previous ones. So if you were putting silicone tablets in, for instance, silicone gel coated tablets, the chances are that you wouldn't get much residue, and that probably it wouldn't make a big difference. And in terms of legalities of disposing, well, wouldn't make too much difference, but I would need to check that legally. I don't think it's going to have the biggest impact. I think it's going to cause more of a headache than it'll gain benefit, if that makes sense. And it'll only be appropriate for certain medications and for certain clients. So yeah, I would probably look elsewhere. For instance, prescribing practices, there's a big win to be had in, if you feel like a patient is going to need a drug long term but you're not sure, prescribe for 1 week, give them the repeat prescription, but only give them a week's worth of drug, and then you're potentially reducing 3 weeks worth of waste. So I think there's other ways to tackle waste.
Thanks, Ellie, and that's it for the moment. But
okay.
Again, everyone, please feel free to keep putting them in. As you can see, Ellie does love a question. Oh, sorry, Justin. In tip number 2, you said volatile agents had a disproportional large contribution to global heating. Could you just clarify why this is? Thanks, very inspiring and interesting webinar so far. So she is awake.
You see, people are awake. Let me find the other slide. You see, I tried to keep this short, Becky. I tried.
I was under no illusion this would be.
Well, you know me. Right, let me see if I can find the relevant slide from another presentation that I gave where I expanded on it a bit more, I think. Here we go. This is heat coming in from the sun, comes to the Earth's surface, and then it either comes back up in the form of water vapour that carries the heat, and it either gets reflected back by CO2 and other greenhouse gases, or it escapes with this big red arrow. What we're saying is that this escape window for thermal radiation, which is heat, escape window from the atmosphere, which is more or less at this sort of level, is blocked by isoflurane, sevoflurane, desflurane, halothane, nitrous oxide. So this window that previously you could allow heat to escape through, which was an important vent, is blocked by the anaesthetic gases. Now, it's important to remember that we do need some heat retention. We do need some level of greenhouse gases in the atmosphere. Otherwise, the Earth's temperature would rise to crazy temperatures in the daytime, unsustainable living temperatures in the daytime, and plummet to freezing temperatures at nighttime. So what it does essentially is provide a blanket, a thermal regulation around the Earth. But the issue is that we've been pumping too much CO2. Let's see if I can find the previous one. Sorry. Here we go. We've been pumping too much CO2 into the atmosphere. So you can see this is a chart of CO2 emissions into the atmosphere. So you get peaks and troughs through the ice ages. This is thousands of years before present. But what happened in the more or less the 1800s, the pre-industrial era, is the CO2 parts per million has just risen exponentially, and you can't sustain that kind of rise and not see an impact in terms of temperature rise at the Earth's surface. And the temperature rise doesn't need to be significant. Remember, we were only talking about a 1.1 degree rise since 1800, and that has had massive impact. You've seen the wildfires in America and the biodiversity issues that we're having, and so we can't sustain that kind of increase. We need to get it back down to a lower level. Can I have a thumbs up as to whether that was enough? Have I explained myself?
I will wait just to see if we've got that. I'm sure. If you aren't aware, sorry, if you go to the Q&A section, there's a little thumbs up, so you can just click on there if that explained enough for you. Or feel free to pop a reply if there's another question that you need asking. Thanks, Ellie.
Okay, right, we'll keep going. My top tip 4 is to create a travel plan. We know that from the data nationally, and also from the NHS data, that travel is an important part, but it's a notoriously difficult part to tackle. The reason that travel plan is important is partly because you'll get direct emissions from commuting and from fleet vehicles, but also that you'll get massive benefits the more people you can engage in active lifestyles in terms of reducing comorbidities. So I think that there's studies showing that if you can get people engaged in active lifestyles, you can reduce mortality rates by about 30%, and that's across all cause mortality, across respiratory illness, diabetes, obesity, cancers, all sorts of causes of mortality. Not to mention the morbidities that cost the NHS carbon resources and cost society. So it's a two-pronged approach. One is that you're trying to get people active. So you're not necessarily trying to force people to commute to work, because that is not always possible or indeed desirable. It might not be safe to commute actively to work, but you can get people engaged in active lifestyles at home. That keeps people in work because they're not getting sick so often because they're healthier, but it also reduces the carbon impact of society as a general. So I've put a load of information on the screen there and some websites. The cyclestreets.net I really like, because there's a journey planner option that you can click a quiet journey on. So it might not be the fastest way to cycle to where you want to get to, but it'll give you a quietest route. And everybody that I've asked to look on this for cycle routes has gone, oh, I didn't know you could cycle from there to there by that route. And so they find a way to get from where they need to be that's a family friendly or a quiet route. So that is, I'm going to leave top tip 4 there because it's such a huge topic, and there are loads of resources through the websites that are there for how you can engage in that. It's an important one to do. It's not the easiest one to tackle, and it'll be very site specific, is what I would say. Okay, top tip 5. Oh, yeah, top tip 5 next. Any questions on that, Becky?
Not so far.
Okie dokie. Right, this is possibly one of the most challenging parts of what we've come across at Davies, and an area which I wish I was an expert in, but I'm learning quickly. Is to start a conversation. You don't know where other people are on their journey towards sustainability, and you don't know what barriers they have. You don't know what things they care about. And so when you come in to a sustainability journey with your agenda and you try and railroad other people into your agenda, they push back against you and you get nowhere. So I think it's valid to start to think about how we can manage change. Now, change management is a whole professional field. You know, there are consultants in this area. So they would suggest, well, one framework that I quite like is there's the 8 principles. I think the COCH, as in KOCH, principles of change management. So they would say, create a sense of urgency, describe an opportunity that will appeal to people, build a guiding coalition. So you need a coalition of effective people from within your organisation. So not just the enthusiastic people, you need the people that are doing those roles. So for instance, you need your procurement person, you need your finance person, you need the people that are segregating waste to all understand how this works for them and what they need to do. And that needs to be built into their job descriptions. You need to form a strategic vision, and it's providing targets for people. It's providing coordination to the activity so that it's not just one person pushing forward with something that never works. You need to enlist a volunteer army. So those are the enthusiastic people that help to get a large scale change. And you need a significant enough number of people per business to make that going. And I would say that we have 10% of people who would say we're part of Green Group at Davies, but actually probably everybody at Davies agrees that they live the green values, if that makes sense. You need to enable action, so you need to take away the barriers, but to do that you have to understand the barriers. So part of that is literally just starting a conversation with people and not asking them to do stuff, but just saying, if we were to do this, what would stop it working? Or do you mind if we try this and give it a month and see how it's going? Generate short-term wins. So it's really energizing to get some wins and to say to people, look, we've done this, isn't that great? And then that gets people on the journey. But then you've got the job of sustaining the acceleration and getting people to keep change going over the long term. And that's probably where we're at with Davies, and that can be a harder job. So you need a leadership role at that point. One thing I found very positive to do is to reframe the debate. So a lot of times you'll get people saying there's no point doing this because it won't make a big enough difference. And there's the SDU, the Sustainable Development Unit of the NHS, has produced this 10 common myths, which is a nice document to look at in terms of how to attack those arguments. But you say to people, for instance, you know, we wanted to change our waste management protocols. Well, that will be too hard. The nursing team won't like it. The clinicians won't understand it. The managers won't want to pay for it. So you can reframe the debate and say, well, actually, it's a legal responsibility. We've got to do it. It's actually going to save us money. It's really, really good to do. It's going to make it easier because we're going to teach people how to do things. We're going to reduce the number of bins in the clinic because we're going to just focus on what we really need to do from a legal and saving money time framework. So it's going to take down the hassle for people. We're going to make this process simpler for everybody to understand. So you reframe the argument into one that gives you an opportunity. If you're interested in more about how to direct behaviour change, there are 2 webinars produced by Libby Cameron Thompson, who is a change consultant, but also there was the Sustainable-ish online festival very recently that has 2 very interesting webinars on behavioural change, and it's not directed at the vet industry, but Libby is giving one of those, and she is a vet first and a change consultant second. although I think she does more change consultancy these days. So there's lots of things to look at, but it's really important that you tackle this change, the idea of change management, because if you don't, you end up irritating rather than agitating, and then people just put up their walls. So a good example of this for me is plastics versus infection control. We know that there is a massive problem with plastic usage, and we know that a lot of people are engaged on how to deal with plastic usage. But we have a bit of a plastic addiction issue, particularly in healthcare, where we feel that we have to cover everything in plastic for it to be clean. And the fallback has been dispose of it if it's in doubt, rather than reusing equipment. But I think we need to start asking questions and basing on data rather than assumptions. So I mentioned the reusable fabric hats already, but there's this data from this study from the dentists where they sprayed MRSA on this dentist chair, and they cleaned it either with detergent or bleach, or covered the chair in a disposable barrier plastic. And essentially all three methods were as effective in reducing the MRSA load of the chair. So you can spray detergent and clean it, and that's as effective as a plastic barrier. The risk is with a plastic barrier that you make people think it's clean, but the plastic barrier can be dirty. So we have to get some evidence based on this, and this is where we really need engagement from across the sector, which is coming. I think the other thing to do is ask people, what do you care about? What's the important thing for you? And again, I've put some resources here of where you can get more information or support for the particular things that people are interested in. And again, I'm sure Becky will say, if you have particularly topics that you're interested in, particularly with preventative healthcare or medical issues, then we can look at producing a webinar on those issues. So I'll leave those with you. This webinar is recorded, so you can attack all of these resources at your leisure, and we'll put them into the FAQs as well.
Ellie, there has a question came in just before you started, so I think you have covered some of it, but
yeah.
Thank you very much for a really interesting webinar. Do you have any tips for trying to engage your corporate group? I find I often hit the management wall when suggesting greener ideas. Thank you.
My experience is of Linnaeus, and they're very engaged. So yeah, how do you engage them? I think that you have to be persistent in your messaging, but again, it's this idea of agitating, not irritating it, and then presenting the opportunities to them. You know, saying why is this an opportunity for businesses? And I think there's a number of reasons that it can be an opportunity. Maybe if I put this slide up again. The way that I frame it is that you can become more sustainable in your resource use, which will reduce your carbon emissions, which almost always saves you money, and like I said, gives you some quality control. You can look at your CSR, so your corporate social responsibility. If you are dealing with sustainability, that shows good governance, and corporates should be looking towards good governance models. But it also enhances your recruitment and retention, particularly of the millennials and Gen Z. They care about sustainability, and if you don't target sustainability, then you don't engage those generations. It gives you a model for marketing to your clients, so it's this idea of promoting trust with your clients. And some of that goes into risk management as well. If you fail to be dealing with sustainability, there are significant risks in terms of legal compliance and reputation that you're allowing to exist. And also you're failing to adapt and mitigate potentially to the risks that climate change present to our sector. So I think that there are significant reasons for a corporate to tackle sustainability, and you have to sort of just gently represent those, I guess, would be my suggestion, and be persistent. Yeah, that takes some going at, but I think that you can get there, and there's more and more support for that model now. So if you want to, I'll put my email address at the end. If you want to email me directly, then I can see if I can come up with any other gems as well, or if you can describe the particular barriers, then we can say, okay, well, here's some websites. These give you some resources. Take those to your management, see what they say to that. Yeah, I put these resources. These are resources for engaging with different sectors, which I've just found recently, and I'm interested in, and I've found them interesting and useful. The regenerative agriculture is a big thing for particularly people in farm practice, but I think we all have a responsibility to understand where our food is coming from and how we can get it in a better way. And that webinar is brilliant. It's a really lovely regenerative agriculture webinar to say these systems can be very productive, are sustainable, and produce better ecosystems, which means more nature, more biodiversity, better quality food. the question, somebody posed a question in that webinar that said, yeah, but you're not going to be able to provide food for the whole of the world. The point is that soil fertility is running so low to the point where we will run out of nutrients in the soil to actually provide food. So we have to provide alternative ways. It's not a choice of carrying on as we are. We can't carry on as we are. We need to find alternatives, and there are good models for how to do that. We've put some resources on our website that you can access. We put a how to be a more environmentally friendly pet owner, and there's loads more resources coming available for that. I think if you're interested in this field, then click on a few of those and see which take your fancy. And that is my top tips. You see, I did try to keep it relatively short, Becky. That's the end of the sort of formal presentation, but I am more than happy to take as many questions as come in. And if we run out of questions today, then you're welcome to email me directly, and you're also welcome to send questions to Becky, and we can put those into the FAQ document later on.
Thank you, Ellie. I haven't got any at the moment, but I know there is a little bit of a time delay, so please do feel free to pop your questions in. As Ellie says, she's more than happy to be emailed your questions. It's very much a keen passion of hers, as you can see. And with myself as well, any feedback, as Ellie said, if there are specific areas or webinars that you would like us to focus on with any of our clinicians in any of our departments, do let me know. And I will pop my email address in the Q&A for you as well, so please do feel free to do that.
What's your, Becky, because you were with us from the start of the sustainability journey, really, for Davies. What's your perspective on the value from marketing and CSR point of view?
So absolutely, I mean, this was one of the biggest of, even if you have someone, which I think you'd be hard pushed to find, but if you have someone who has absolutely no interest in sustainability or being green or any interest at all, there are 2 points. We know, and Ellie has proved that from a point of view of financially, you will save yourself money, but more importantly is the appeal, and Ellie's absolutely right in the fact of people are looking now to work somewhere where they can see that the company cares about the environment, because it is such a massive topic and you absolutely need to be making it your priority. So from our point of view, we have a separate sort of emailing list for sustainability. So we have CPDs and we have people sort of signed up to our website. We made a specific one for sustainability and we got a huge uptake on that, and it just shows, I think, how engaged people are and how much it's a wanted topic, certainly in a profession where we are very much behind the times, I think. But Ellie is certainly doing her very best to sort of put us to the forefront right now.
Yeah, I mean, and I am the kind of the visible person on this, but we the team at Davies are all engaged. I mean, it goes down from financial directors across to maintenance, across to kennel assistants, to pain management team. Everybody is engaged in thinking, well, what can I do? And we get all sorts of random emails from across the practice, don't we, of like, can we do this, can we do this? And one of our ophthalmologists emailed about tree planting, saying, I want a tree plant, it's National Tree Planting Day next month. And then we did our carbon offset scheme on the basis of that with forest carbon. So we're offsetting 25% of our footprint from 2018 with forest carbon. It's not the only solution, it's not the only thing we're doing. We're certainly reducing our carbon footprint as well overall, to the point where hopefully we don't need offsets in the future. But these ideas come from all over, and it's just welcoming that, opening that.
Yeah, and I think it's like you say, it's the small things as well. I think one day you came in and the toothbrushes they used to clean the clippers had been replaced with bamboo toothbrushes, and you thought, this wasn't something Ellie pushed, this was something, a very small gesture, and obviously, it's these kinds of things is allow your staff to have those ideas and implement those ideas, and you'll be surprised who sort of comes out the woodwork, for want of a better phrase, as the idea.
Yeah. I mean, one of our surgeons, one of our orthopedic surgeons, Ellie Coburn, has come in with these really, really cool fabric hats, and I've got serious fabric hat envy now. Like, they've got really cute. I think they're dogs of some kind, whether they're Daxies or Springers. Oh no, they must be Springers. She's got a Springer. And I'm so jealous. I want one.
Started the trend, isn't it?
She started the trend.
We've had a question in. Thanks, Ellie. This is my favourite subject. I should leave you two to talk at the end of this.
Yeah.
What changes do you think have the biggest impact and are worth pushing most to bosses? I have discussions with them regularly, but struggle to see them changing anything.
I would carbon footprint, because and when you carbon footprint, you can get from your bosses the cost per kilowatt hour of your energy, and then you can say to them, we expect to be able to reduce this by 5-10%, and that will translate to X pounds. And so that gets them engaged in the green agenda if they are only interested in finances, or if they are only interested in the marketing opportunities. You say, right, well, let's join investors in the environment and we get our accreditation, because any time that you engage in these processes, other things will happen collaterally. So engage them on one aspect of it that means the most to them. You have to find out what it is that means the most to them. And a lot of the time it's just bandwidth, like particularly during COVID, people don't have bandwidth for dealing with a lot of things. For us, investors in the environment really helped because they gave us a structure and they gave us a kind of target to achieve, and they gave us the accreditation and all the support for doing that. So I think that they are a valuable resource to look into, and you have to set off the membership costs with the average savings that IE practices achieve, and then looking at the costs savings that you'll make, and then that covers the membership cost. So I would look at carbon footprinting to start with. It's a relatively easy thing to do if you just target the ones that I've given in the presentation today. Yeah, I'd start with that.
And I think, like you say, the big thing was, I think you took so much of the responsibility of the investigating, looking into things, and away. You did all that work, which is the legwork that I think if you say to someone, oh, we want to be more sustainable, immediately you think that's going to be huge amounts of work. But if you can start implementing things yourself and having the ideas, it certainly helps from the sort of management down.
Yeah, I suppose here's my other thing. If you engage your procurement person and say, look, IMS has a green list, can we start to switch to some of these green products? And you get someone in management to say to the procurement person, look, if this product costs less than 20 quid extra per year, don't bother me with it, just go ahead and do it. And then what you start to see is visibility of green products coming through the practice, and so people start going, oh, we're green now. Yeah, we are green now. Okay, so and things like fabric hats, reusable masks, if your practice is happy using those, it all starts to add to the visibility of a green agenda. And then people start going, well, hang on a minute, I want to do green in my job. And so then you find other people who have options to choose a green option will start to choose the green option without you having any involvement in it. So it cascades down other people. So I think that in terms of visibility of agenda, that sort of change is relatively simple to institute and will give you quite big effects. So that if you don't fancy carbon footprinting, if data isn't your thing, that would be my other suggestion, is to look for green products.
Another question, I might have missed this at the beginning, but I don't think you did mention this, Ellie, but do you have a green energy provider, and if so, who do you recommend? I use Bulb at home. I guess I have to say there are other green energy providers available. Yeah. But wasn't sure if this might be a better one for businesses.
So energy providers, as you will gather from domestic usage, will give you a deal based on the negotiations that you make with them, and so it really is very dependable. Not all of the renewable energy providers will provide electric contracts for, and we're talking about electricity really here. Not all of them will provide contracts for businesses, so you have to look for one that will. I don't know whether Bulb will. I know that Octopus Energy does do. And I know Robin Hood Energy does do for business. So I think you just have to look for the one that suits your practice the best. There is a website called greenenergyswitch.co.uk which can help you with switching domestic and business providers. So you can ask them and they'll compare tariffs across the range for you. The other thing is that you can ask your energy supplier, whoever you're with at the moment. They will often have a green tariff that will provide 50 up to 100% green energy. And it might have a different cost, but I think in terms of CSR, it's invaluable. In terms of reducing your own carbon footprint and making your staff feel happier with who they're working for, it's invaluable. And you can also tie that in with a change in engagement turning off electricity efficiency so that you reduce your electricity usage and make the switch cost neutral. So yeah, there are other energy providers. New renewable energy providers are coming onto the market all the time. But I would, if for the easy switch, I would ask your current company, have they got a renewable tariff? And most of the big companies do.
Thank you, Ellie. I think that's all the questions through at the moment. If we do miss any at the end, as I say, please do feel free to email Ellie or myself. I have popped my email address in the questions. I hope you found it interesting. Thank you as ever, Ellie. Certainly a topic she's very passionate on, and more than happy to sort of take your questions in the future as well. And we wish you all luck with your journeys and your own practices to a more sustainable route. So thank you, Ellie.
No worries. Thanks very much, Becky. Cheerio, everyone.